So you've completed your breast reduction surgery. Congratulations. I'm sure you're feeling a lot lighter and more comfortable already. We'll have you in the ward immediately after your surgery. You may or may not have drains depending on the size of your breast reduction. Usually I'll leave those drains not longer than overnight, and the next morning I'll take that out. Don't worry, the drain removal is really not painful. It's an unusual feeling, but it's really not uncomfortable. The pain medication we give you overnight is really a trial of what you're going to be taking home. Specifically, it'll be paracetamol, Nurofen, or Celebrex, basically an anti-inflammatory drug, as well as tapentadol. Or if you have any other allergies or sensitivities, we'll adjust accordingly. This should control your pain overnight, and then that's the same drugs that you will go home with, and you should feel comfortable and confident when you go home that you know exactly how to take these medications. I'll have given you 3 doses of IV antibiotics overnight, and that is really to do a little bit of prevention of any infections in the short term. When you get home, take it easy. First couple of days, really rest. Do very similar to what we're doing at the hospital, really lying on your back. You're up a little bit during the day. You can start taking short walks over the first few days after your surgery. That will be able to be extended within the first week to about a kilometer or around the block by day 10. I'm happy for you to start driving day 10. I'm happy for you to start sleeping side to side at about 2 weeks after surgery. I'll usually see you at between 7 to 10 days just to check in and make sure that you haven't had any signs of a bleed or hematoma, and that's really the most reversible concern that I would find within the first 10 days. Between the first consultation after your surgery and the second one, you can start extending your walking. 2 to 3 kilometers should be fine. I don't mind if you're up and about during the day. You're always wearing a nice supportive bra. By 3 weeks, you can start doing longer walks, 3 kilometers to 5 kilometers, but still no high intensity exercise. I will review at 3 weeks and usually take out some externalized stitches which prevent T-junction breakdown. I'll then usually see you again at 6 to 7 weeks, at which stage we start changing the scar management protocols from brown micropore tape to silicone gel. Usually at this stage, you're well over the early phases of healing. I'll check on the T-junctions because these can still be a problem up to about 7 weeks after surgery. Your results will continue to improve. Your scarring will mature. From this phase, it may become slightly more pink up to about 3 months before it starts to fade. The final scarring will be predictable at about 18 months, and that should be the kind of end point that you can expect. In the interim, I'll encourage you to use micropore tape. I'll encourage you to use silicone gel daily for the first 3 months, and then possibly some bio oil or vitamin E massage. You can, if you want, and you're really conscious of the scarring, look into options like LED light or laser therapy, but I think the quality of your scar will ultimately be very good. Well done for taking care of your result, and I look forward to taking care of you for the rest of the recovery.